Hello, it's Dr. April.
And I'm Dr. Kyla.
We're at Effingham Pelvic Health. So we have our models here. We have these in the clinic to demonstrate to patients the different pelvic floor anatomy and the muscles. So we just briefly wanted to go over the muscles and educate you on those and how those can play a role in pelvic floor dysfunction, such as pain or leakage, overactive bladder, urgency, things like that. So male and females have the same muscles, they're just arranged a little differently. So we'll go over each one. I'll demonstrate on the male model and then Kyle will demonstrate on the female model, okay? So here on the male model, if you look underneath here, so the base of the penis would be the bulbospongiosis, and then Kyla's going to show that muscle on the female.
So it is, it's hard to do it this way. So bulbospongiosis, it kind of runs up and down this way, here and here.
So it'd be like underneath the labia
Here.
region. Yep.
On the sides.
And then we have the superficial transverse. So here on both the female and the male, that's the anus. Okay. And then we have the external anal sphincter that wraps around that circular muscle. And sometimes that can cause pain and spasms. This tissue through here, right above the anus for male and female, is the perineal body, where a bunch of these muscles come in and connect. In the female model, that is sometimes where women will have a perineal tear or an episiotomy. And then the superficial transverse connects from the perineal body over to like the ischial tuberosity. So it's this muscle on this side, it's on both sides. You can see on Kyla and I's model. And then the last muscle is the ischiocavernosus. So you can see through here, it kind of comes up in this region, so like underneath the scrotum. And then I'll let Kyla kind of demonstrate on hers.
Yeah.
So yeah.
Kind of like right in, what am I doing right in here?
So this through here, so this little bitty muscle that kind of comes along the length.
There we go.
There, yeah. So they're very similar, just different, arranged a little bit different. So we tell people all the time, we do vaginal and rectal exams all day long. It does not faze us. I know that's the biggest concern for people coming in to see us is, I don't know about that. We go very slow. We do what you're comfortable with. And if you're not ready for that the first visit or so, that's okay. We can do other things to still help with your condition. So that's just a little bit on the anatomy of the male pelvis and the female pelvis. Reach out to us if you have questions.